This is my camera. Let me know when you're ready.
This is mine.
2,
Call me.
1.
Hey guys, good evening. I'm Dr. Wilton Triggs. Welcome to Triggs Table Talks. And today I have a very special guest, a personal friend of mine, one of my first friends in Miami, Dr. Safiya Lyn, who is a integrative emergency department cannabis doctor. Can you say it?
Close. So essentially what I do is marry my two careers, which is emergency medicine and medical cannabis. So I'm an integrative medical cannabis and emergency medicine physician.
She said that so eloquently. So great. She's the bomb. Man, this is going to be a great episode. So a lot of my patients always have questions on smoking,
Yes.
Cannabis and things like that. And for me personally, in my practice, I don't cancel patients for being THC positive because, at least from my understanding, a lot of the literature shows it doesn't affect wound healing or anything like that. The only thing that I'm very, very big on is nicotine because that will tear your results up. But before we even dive into that, so tell the people who you are, where you come from.
Thank you.
You know what I'm saying?
Yes.
Definitely drop the education. Let them know that you're legit.
We go back in the day.
For sure.
Both Triggs and I graduated from Meharry Medical College, our alma mater. Love it. It's been an amazing journey.
Yes.
And went through emergency medicine residency in Morristown, New Jersey. And made my way down south to Florida. Great taxes, great weather.
That's right.
And opportunity to purchase and invest down here. So started my emergency medicine career down here 10 years ago. The state of Florida became legal for medical cannabis use in 2016. So that's when I launched my practice, Ask Dr. Lyn. And it was really a platform to serve as an education site for credible information regarding cannabis because there was so much misleading information out there at that time and, conspiracy myths and theories and, oh my gosh, you're an ER physician, you're going to lose your license if you prescribe cannabis. But understanding the benefits coming from a West Indian culture and background, I was able to give more history and help patients to understand the importance of having their own personal autonomy and deciding how to medicate and care for themselves, but most importantly, being able to make informed positions and advocate for yourself. I think that's the biggest thing that I emphasize with my patients. If you want something, if you want to explore something, make sure that you have a open communication with your physician and advocating for yourself with questions and answers. And if you don't feel that you're getting the response you need, definitely explore further and deeper into other partners or other people who may be able to give you a better idea of how cannabis can be used in a safe medical manner to help you heal.
Man, that's dope. That's so dope. I couldn't have said it any better. So where did you go for undergrad? What made you become a doctor? What was that spark moment I want to do this? Or were you one of those kids that growing up you always knew you was going to be a doctor?
Let my mom tell it. I always wanted to be a doctor. And I think as far back as I can remember growing up in Bronx, New York, I went to undergrad and high school in Washington, D.C. Graduated from Trinity College and took a year off and went to NIH and did some research there and got published there before starting medical school. My journey was up and down because when I was in D.C., I was having way too much fun.
Oh, yeah. I just came back from D.C., so I understand, yeah.
Had to take my NCAT multiple times, and then finally I was like, okay, let me buckle down. So it really took me, getting out of my comfort zone and moving to Nashville, where I didn't know anybody, and isolating myself in order to be serious and concentrate. But home and my roots are New York and then polished in DC and then spent time in Nashville, Tennessee for medical school, back to New Jersey for residency, and finally been in Miami for the last 10 years.
So what is some of the crazy stuff you've seen in the ER since you've been down here practicing in terms of plastic surgery wise? Because I know you've seen it. I know you've seen it.
See, you fix them, but then I see them on the post-op and they're sometimes just in terrible, terrible conditions, super anemic, requiring blood transfusions, botched procedures where they have poor wound healing and require grafts and wound care and stuff like that. Post-op infections. Most times patients are a little immature and young and don't follow the physician's directions to a T and therefore end up with post-op infections, whether that's intra-abdominal infections or superficial infections in their wounds and stuff like that. So I see anywhere from sepsis to superficial infections. There's an array of all possibilities. Like surgery is surgery. So regardless if you're doing it for purposes of physical enhancement and beauty or necessity, it's important to take it seriously because there are always complications possible.
I feel like, when people think about cosmetic surgery, they don't think it's like big surgery.
They don't take it serious at all.
Yeah, exactly.
No.
But every surgery has a risk. Anytime you go to sleep, anytime a knife touches you, it's a big thing. And I think like when I go into consultation to talk to patients and I'm like, I'm very monotone, very like straightforward, they're thinking like, oh yeah, I'm having surgery, I'm getting a BBL. I'm like, no, ma'am, like, this is serious business.
Let's
here.
break it down.
Yeah, exactly. This is serious business. I don't want you to end up in the ER. I want you to like, enjoy your results, but we got to be safe about it.
I think patients take for granted, especially with instant gratification these days. They see the results on social media and they don't see the journey from entering into the office, being qualified, making sure that you are a good candidate, a safe candidate to undergo anesthesia and a procedure like this. Talk about, preventative health, talk about past medical surgeries and histories and stuff like that. And then also detailing, like you said, what's your drug history? Right. Do you use cannabis? Do you use other means of medicating? So that way they can understand how to best manage you. Right. We have to think about things like withdrawal from cannabis. We have to think about post-op delayed healing due to smoking and things like that. We have to think about lung capacity and anesthesia and its effect on your ability to maintain the duration of the surgery. Sometimes you need additional anesthesia if you're using cannabis. So all of those things we take into consideration that patients don't really see the effort that goes behind the scenes. And you don't need to know, but you do need to understand that this is absolutely super serious anytime you're going under the knife.
Exactly. I try to tell them to trust the process. Like it is a process. And so like and you kind of read them like during the consultation, like if they have a good grasp of what they're going to, because you have those super like well researched, they've talked to people, and I'm like, oh yeah, you're gonna be fine. But then it's the ones I'm like, oh, they're a little green. Like I'm worried about them, and I really do. Like I had a patient like that today. I'm like, say I want you to reach out to this person because I know that there's like I don't know what they call themselves, but a lot of like the post-op, the concierge nurses, and some of the
recovery centers.
They can kind of coach them like, yo, this is what you need to be like on, and I highly encourage like post-operative nursing and recovery and stuff like that.
Absolutely, those massages are critical. Those lymphatic drains are critical. Understanding your pain tolerance level. Constipation is a huge post-operative issue
and
that we have to manage.
That's probably something I probably, as a physician, I need to touch a little bit more on, like, because I put some patients on that say they have a history of like constipation. I don't really like dive into that, but I can probably do a better job of like, yo, this is what to expect when you're on, these narcotics, and then even the narcotics when during the surgery.
And not even to be surprised that you may not have a bowel movement 5 to 8 days post-operative, and that's not unusual because your bowels slow down when you're put to sleep. So just helping them understand what to anticipate post-op. And I think you do a great job in helping patients to see the before and after, and in between, I'm hoping that they're absorbing all the knowledge that you're giving them, because I know you're giving it to them.
I try to drill it.
In
like,
English, in Spanish,
I've seen
paper,
your videos. I'm like, well, you about to hear it one more time. Like, we about to go through
We're
it.
about to consent you properly.
Yes, exactly. Like, I do not play around with that. So I know, like, if a patient is like complaining about something, I'm like, nope, I told you about that. I know for a fact I told you because I have like a list in my head, and I drill it every time. And if I feel like they're like cutting me off or trying to talk over me, I'm like, okay.
Let's circle
from
back.
the beginning. Exactly. And I start right from the beginning. Like, I do not play around with that. So, like, switching subjects. So, I'm a marijuana novice. I don't really know as much of it. My first time, I know about marijuana. Like, I've partaked in it before. And this was in med school. Like, I feel like I was a little bit older. And, but, I have friends that, like, the quote unquote experts, very experienced. So, what are is there 3 different types of marijuana? Like, what is it? Like sativa, the
indica, hybrids.
And then there's a hybrid.
Yes. So absolutely, there are different types of marijuana, but we've kind of moved away from that direction of labeling and isolating cannabis in terms of sativa, indica, and hybrids. It's a little bit of a old school way to describe it. Now we really talk about like the terpenes and the flavors and the essence and the ability for it to affect different aspects of your psyche, of your emotions, of your comprehension. So we really are looking for that full entourage effect with the combination of CBD and THC, and that's been what we're advocating more in the field to educate physicians on helping patients understand you don't want just THC.
Right.
Like the anti-inflammatory component with CBD always adds and enhances the ability of THC to do its best job possible.
Yeah, and I'm glad you brought up the like anti-inflammatory part of it, because I have my cousin, like she's used the oil before, like having like joint pain and stuff like that.
I love that.
And she was talking about like, yo, like this stuff really works. And she doesn't smoke. She's very, L7, very square.
I love that.
I love her to death. But she's not. She doesn't party. She doesn't do all this. She barely drinks. But she tried that CBD oil. She was like, this stuff is amazing. She was super, super happy about it. And I feel like, there's some powers that be that don't allow that type of information to really become as mainstream as it can be unless you go searching for it. Because if you go searching for it, it's like right there in your face.
Absolutely.
And I was wondering, like, from your perspective, what are some of the benefits that, may not be as mainstream in terms of, medicinal marijuana or marijuana in general that you would like to like put out there that people to really like research or take their time to look into? For
sure. So as much as I advocate for medical marijuana, I overall, overarching, my entire goal and ethos is to advocate for safety. So helping patients to understand the importance of consumption, modality of ingestion, your exposure and experience with cannabis, the duration of action, the safety component, like all of those things are really critical when you're recommending cannabis to someone. So for you, someone who's a novice, I would start with a lower dose of THC, probably around the 5 milligram area, and slowly build depending on what our goal is. We always want to use cannabis with the intention, and that's a difference between quote unquote adult use, or formerly called recreational use, and medicinal use. You really, and most times patients don't even understand this, that anytime you go to light up a joint, go to grab an edible, take a tincture under your tongue, use a suppository or a topical cream, any of those modalities that you're using cannabis in, you're doing it with an intention and goal in mind. So when they describe adult use or recreational use, sometimes you don't have a clarity as to your direction and purpose, but you're like, damn, I had a messed up day.
Yeah.
Like, let me just hit one right quick.
Yeah.
You know? And not understanding what you're really trying to manage and address is that stress, that anxiety, the traffic that you just spent 50 minutes to drive down here from Davie to Doral. Like, navigating all of those feelings in order to be able to calm down and to relax and to be present for your family and friends once you get home. All of those things have an intention and purpose behind it. And I think when you use it with a clear goal in mind and understanding what you want and desire to achieve with use, I think that's what helps people to understand, okay, I don't need to go with the maximum dosage.
Right.
I can use as minimal as possible to achieve maximum relief. So that's my education for everyone in the whole process. I'm never like Eastern medicine or Western medicine, but I love to integrate the both.
Yeah.
Having a U.S. Cultural training for Western medicine, and having big pharma, and being from a background where I've seen the benefits of certain blood pressure medications or certain diabetes medications and things like that. Understanding that the complete underlying thought is, if you don't have a sound mind, good spirit, and a clear heart, and a solid body, none of this will be effective.
Right.
So we really have to combine the spirituality, understand the daily stress, understand alternative medicine and how it can complement your Eastern and Western goals. So really, it's a comprehensive conversation with patients, and sometimes if they're not ready to receive that, you might just be hitting them with way too much. So you have to kind of do it on their terms when they're ready to receive and meet you.
Is there, have you been able to like integrate like your, information about cannabis into like the ER, and how does that look?
Good question. Good question. So I'll tell you, when I first started out down here, being one of the initial physicians who recommend cannabis in South Florida, it was received very poorly amongst my colleagues. I was really outcasted, and they didn't have the scientific data to back up what the proposed relief from medical cannabis could be. So they did not buy into the concept, nor were they willing or open to learn more about it. And the thing about cannabis is we were never taught in med school how it can be used in a fashion that could be helpful. We were always told, stay away from it. It's a drug. It's going to make you sleepy. It's going to make your eyes red. It's going to make you have the munchies. They never discussed the benefits and uses of it. And that really wasn't explored until later in life. Even though we've had this endocannabinoid system in our body, which is similar to the central nervous system, similar to the reproductive system, similar to, your GI system, your motility system, we've had this living in our system forever. We've just recently spent time in identifying what the system is and how we can best use it to our advantage. And that's what, THC and CB does. What they do is they enhance the endocannabinoid system, which is diffused throughout all of our body, and they help it to work at its optimal ability to provide homeostasis.
Right.
So really, it's something that we've always had. We just didn't know how to use it. So now that we've spent some time investing in research about this ECS endocannabinoid system, we're able to maximize it a little bit better. But initially, no, I was not received and welcomed into the community, and my peers who were a little bit more staunch, a little bit more narrow-minded in their thinking and had been practicing for 30 years and only knew of cannabis to be evil, weren't willing to digest or understand or reach out or comprehend. But it wasn't until they were forced with the conversation by their patients, because people are coming to your office like, yo, doc, what's this? What's this? I want this. How do I get this? And that forced them to take the next step to find some initiative to at least learn or at least have a reference to refer patients to. So that's how I built my clientele. I was referred several patients. I've never advertised or anything like that. I do a little bit on social media just to reinforce my work. But honestly, it's by referral more so than anything else. And your patients are your best weapons. They go out and they speak on your behalf, and they get their friends and their grandparents.
Right.
And it became a cross-generational healing process, from the younger patients bringing their elders and parents to my office to help them understand how we can use it in a fashion that can help them with their 19 pills that they're taking.
Right. No, I definitely understand that. So to be able to prescribe cannabis or medical marijuana, what did you have to do? Because I can't just go out there and prescribe. You have to have like a special registration or something with the state, right?
Absolutely. So you got to have a clean DEA license. So any practicing active physician is licensed in the state of Florida. And in addition to that, if you prescribe narcotics, you have a DEA license. And your record has to be immaculate. You can't have any probationary things on your record. With that, you're able to apply for a certification, which is an 8-hour medical marijuana course that is offered by the state of Florida. It's a state-specific course that all medical cannabis physicians are required to take. That certification has to be maintained every 2 years to be optimal. And once you do that, you're really kind of given a base of what to do. But what we have no concept with coming out of medical school is how to start a business, how to start a practice, how to get an LLC. How do you know where to deposit your funds that you receive from cannabis training and education and patient visits? I remember one thing that happened to me when I first started out is because cannabis is not federally approved, whereas banks are FDIC insured and federal banks, they froze my medical cannabis account. Because they said I was receiving money from medical cannabis, which was illegal in the state, from cannabis transactions, which was illegal in the state. Granted, I'm not selling cannabis, I'm not selling weed, I'm selling education, and I'm, approving patients by doing the physical exam.
So how long did that take
giving them education.
To handle?
Eventually ended up closing the account, and what I had to do was change the LLC name to exclude anything related to cannabis or marijuana or, MMJ or anything like that, and have a more generic name for the account where it could fly a little bit more under the radar. But yeah, banking was a huge issue at one point.
I never would have thought about that.
So
Dang.
little things like that you run into hiccups that you're not necessarily prepared for. But everything I do is electronic. So
Right.
all electronic payment methods,
Right.
that's what I've always taken. But you can run into hard blocks and road stops, but you just got to continue navigating it.
I didn't even think about that. So for me as a practicing surgeon, is there anything that I should be aware of in terms of medical marijuana, like, a certain type, or, if they're positive, is it really going to affect their surgery? Because at least from my understanding, from the surgical standpoint and like outcomes, like it really doesn't do much. I think there's something that may interfere with some anesthesia or something like that, but I was wondering if you could explain that to me.
Absolutely. So I agree with you 1,000%. Prior to surgery, I would say at least 7 days minimum prior to surgery. Same way like how we tell you don't ingest aspirin, don't ingest alcohol, don't overindulge, even things like sun tanning too much, skin sensitivities, things like that. We want to make sure that you are in your most healthy state undergoing this procedure, whatever that is. So the thing that is important for patients to understand, it's the modality of how you use that has the potential to affect what you may undergo.
Right.
For example, smoking flower, doing vape, using modes where you're inhaling has the potential for airway and respiratory effect. And that can minimize your capacity, which can make it harder for us to ventilate you. Meaning when we put a breathing tube down your throat and we're giving you oxygen, we might need to use a little bit more oxygen in order to aerate and ventilate all your lungs, because you have a diminished capacity from the history of smoking, which, whether you're smoking shisha, whether you're smoking hookah, whether you're
Right.
smoking vape, whether you're smoking cannabis, like whatever it is, it all has an effect at some point in your life. And it's the accumulation of your use that affects that. So you want to be honest with your physician and your anesthesiologist in particular. Secondly, so smoking is not recommended, as you understand,
Yeah.
at least 7 days prior to the procedure. But secondly, as well, you can go through withdrawals from cannabis. So if you're a daily chronic smoker or user of cannabis, you can have withdrawal symptoms which manifest like tachycardia, meaning fast heart rate, difficulty breathing, feelings of anxiety and psychosis. You can also have gastrointestinal issues like nausea, vomiting, diarrhea, abdominal cramping, all of those things that you're like, damn, why am I feeling this? And that's because your body is technically detoxing from something that you use on a consistent basis. And you can see that with things like if you drink coffee every day,
Yep.
if you smoke every day, whether it's nicotine or something like that, you can go through withdrawal. So it's important for your physician to know those things, because as they're getting ready to put you under, they need to understand, why is your heart rate 120?
Right.
Why are you so nervous? Like, what's
Right.
going on? So that way they can best and effectively manage you. The thing that I do like the most and recommend the most for my patients post-operatively, and that is if your physician approves, would be edibles.
Okay.
I like that for pain control because you decrease the risk of constipation.
Okay.
You minimize the risk of abuse. It is easy to ingest in terms of being a chewable product, whether it's brownie, cookie, vape, lollipop. Brownie, cookie, lollipop, a tincture, something to that effect, where you're using a gummy or something like that, so that it's a little bit easier for you to swallow, because typically you're sore
Yep.
post-operatively,
Yep.
and you don't want to swallow a big pill or anything like that, and less side effects. But the most important thing is, if you're a naive cannabis patient, the first time to try it is not when you come out of surgery.
Yeah.
So if you have
that
no
sounds like a good idea.
history or experience with cannabis use, that is not the recommended first time to try it. You want to make sure that you properly do all your consultation, and it is something to be considered, but it's best and most effective for chronic pain.
Right. Oh, perfect. Well, that's a good segue. If like you're interested in this type of information, you definitely need to check out Ask Dr. Lyn, like her IG. We're going to drop it below.
Oh, thank
You got to
you.
click, like, and subscribe. This is the type of information we're putting out there with dope people. So, just keep that in mind. All right. So now, Dr. Lyn, Safiya,
Yes.
it's time for some tricky Triggs trivia. Yeah, we got some questions for you.
I don't know.
We ain't got no prizes. We ain't got no money for you, but we got some questions. Not even a gift card. We might throw you some for your gas though, because I know you came all the way from.
Me up.
You know, we're gonna take care of you. So, I think you've already answered this question. How many weeks should a patient stop marijuana before surgery from an inhalation? From inhalation,
minimum 7 days.
7 days, and that's because of.
And that's because of the potential for lung infections and depressed respiratory situations, and in combination with the use of anesthesia. Also for wound healing, especially with smoking, it can delay the potential for skin wound healing.
Yeah. So y'all hear it. Now, I don't want to hear it in consultation like, oh, I just, I'm a little bit positive. Like, don't smoke. 7 days, at least for the marijuana.
7 days. Now, edibles, post operation, I do support and I do recommend for pain control. Absolutely. Edibles are one of my favorite things. Low dosing, minimal side effects, and minimize the risk of constipation. So I think that can definitely address pain.
Perfect. So as a physician, what are 3 things that patients should stop taking before surgery?
Ooh.
We're taking you back to your surgical clerkship now.
I know.
Or back to residency. Because I'm sure you rotated. Did you rotate on surgery as a resident?
You know I did.
You
know I did. So let's see. Absolutely. The thing that I would recommend that patients stop prior to surgery would be alcohol.
Yep.
And the reason for that is the risk of withdrawal, the risk to decrease your ability to metabolize anesthesia, and also your risk of possibly having co-ingestions with alcohol. So when we talk about co-ingestions, the other things we're talking about are like Tylenol, aspirin, blood thinners, those things that when you undergo surgery, it can increase your risk of bleeding. Yeah. So alcohol, blood thinners are really important. And blood thinners have a specific window depending on which one they are. Typically, the minimum is 72 hours to stop blood thinners prior to procedures. And then you want to be what they called NPO prior to your procedure, typically 12 hours, 8 to 12 hours fasting prior to going into the procedure. So no food, no water, no coffee that morning. Yeah. Prior to your procedure, and you want to do that at least 8 hours prior to going in.
I remember when I was in training, we had this one anesthesiologist. He would always go up to the patient and say, "Oh, so how's breakfast? What'd you eat for breakfast this morning?" And that's how he would trick them up every time.
And like delayed, pushback, canceled.
Exactly. So what are some of the differences between nicotine products and marijuana products in the body that you've seen or that the literature talks about?
So in literature-wise, the difference with cannabis and nicotine is cannabis is, depending on how you're obtaining your cannabis, it's from a plant. So we're talking about a plant-based product that's grown in the ground, in the earth, and has been cultivated and produced and manufactured to help patients achieve relief, whether that relief is intentional, trying to help pain control, trying to minimize seizure activity, trying to address nausea, vomiting, appetite suppression, whatever your goal is in using cannabis, it is a natural product. Now, depending on how it makes its way from seed to sale, meaning from when it's first grown to actually getting into your hands, there's a lot of different steps that can be done. And the thing that we worry about most about are synthetic cannabinoids. Yeah. So we talk about K2, we talk about spice, we talk about manjo, all those things that you see in the ER where patients are having negative side effects because the synthetic cannabinoids bind to the THC receptors in your body, and they hold on to them super tight, so they have a longer lasting effect on your body that increases your risk for psychosis. Right. So you always have to be careful with make sure you're choosing organic, clean product. Right. And I say that to everyone, whether you're going to a dispensary, whether you're going to a local farm, whatever you're deciding to use, make sure that it's third-party laboratory tested, make sure that it's independently identified for what you're ingesting, and you understand on all the things on the labels. So I can't emphasize safety, anymore than we have already in this podcast. I think that's the unifying theme that we're both trying to.
Where are people getting these synthetics from? Because I don't know if I remember like hearing something about people were getting them at gas stations or something like that.
Yeah,
crazy.
definitely. Gas stations, black market dealers, and things like that. You can grab synthetics. Synthetics are typically what we call a designer drug. So it's laced with other components of cannabis. So it's not pure THC. It is laced with other products, whether it's ketamine, whether it's fentanyl, things that have lingering effects in your body and typically negative effects. And it causes you to be hyperpsychotic.
Right. So people that get synthetics, are they like really trying to get the synthetics, or are they just trying to like get like something like marijuana to be something similar to it, and they just get either tricked or?
You got to ask them.
Okay. Now I was just wondering.
But typically, I will say I don't know of many patients, even my chronic drug users that I see often in the ER that, identifies themselves as intentional and chronic drug users. They are not necessarily going out there to purchase or obtain a product to hurt themselves.
Right.
They're typically doing it for the intention of getting high, and sometimes it's just a little too high.
Yeah.
And that's where you get that turn, that you start to get the negative side effects from it. So I don't think it's really typically with the intention, unless you are suicidal and trying to harm yourself or someone else.
Right.
Typically, they go out there and they purchase something that either you've purchased from someone before or you're trying something new, but it's not with the intention to harm yourself. It just happens that that's what happens.
Right.
When you ingest something like that, you have that effect.
Gotcha. So now we're about to dive into some more personal questions.
Dun-dun-dun.
Yeah, exactly. You should be really afraid. No, it's going to be all right. So what made you choose ER? Did you originally want to go into ER, or, what brought you into it?
I applied for derm and ER both at the same time, simultaneously. I love them
So
both.
two competitive specialties.
Super competitive. And derm, I got waitlisted, and I had to do a prelim year in whether it was surgery or family medicine or something to that. And then ER, I got accepted on my first round. So we go through this residency match. All the medical students match in the month of March at some point to their listed location that they've ranked. And I got into ER on the first round versus derm. I would have had to wait. And I didn't want to wait. At that point, I was pregnant. My daughter was due to be delivered in October. So I didn't have time to, and luxury to be like, let me bounce my family around from one state to another state. And the second reason was ER, I got to wear tennis shoes every day. It was really a preference of
comfort,
lifestyle, comfort, flexibility. I could work as much as I want or as little as I want, and also the immediate gratification. That was something that typically patients to the ER either leave super happy or super upset. So, and most times they leave happy because you've improved their pain, you've fixed their laceration, you've reset their ankle break, like you've done something to help improve their life, whether that's preventing them from going to the cardiac cath lab or having a surgery by treating them with antibiotics. That's something like that. You've caught it early. But I had the opportunity to have direct patient engagement and interaction with immediate results. So I didn't have to have that, reoccurrence of seeing patients 3 months later, 6 months later. How you doing? It was like on the spot, immediate. You're happy. I'm happy. See you later.
You treat them, just treat them.
That's
Gotcha. I heard that. So what would you do if you weren't a physician?
My background is bartending. So I bartended all my way through medical school, all through college.
It's better than stripping.
Hey, you gotta get it how you get it.
Yeah, get it how you live.
So I love that because it's very similar to emergency medicine, where you walk in like, hey, nice to meet you. How are you? How was your day? You get to have a conversation with patients. So I loved that. Being my pastime, being cash business, I got to always go home with money in my pocket. Like, that was a thing for me. I felt satisfied in that process.
So were you a good bartender? Like, you could make like really good cocktails and stuff like? Oh, okay. Excuse me.
I was not a rum and coke girl.
Okay,
perfect. Everything with
perfect.
flair, everything with pizzazz. Definitely mixology.
Do you do the like little twirling thing and you like?
I could.
Oh, wow.
we could light a drink on fire. We could do it all.
That's dope. I did not know that.
I wanted to own a bar, but I wanted to own a bar like Cheers.
Yeah.
Where I knew everybody and they
Everybody
me.
knows your name.
You come sit at my bar, you hang out, you bring your friends. Like it was a specific type of bar I wanted to do, of something intimate that everyone wanted to go to and hang out with in the afternoons. But yeah, I would have definitely owned a bar. That would have been my next thing. And with the infusion of cannabis beverages, we could offer that there.
Yeah, so I had like a cannabis Bloody Mary at the Thompson. Have you been at the Thompson? Stay at the Thompson in Nashville?
Yes.
They have like the cannabis Bloody Mary, and I remember like drinking it. I was like, man, I feel real good right now. No, it was an experience.
So,
like I was just sitting at the bar like Sunday brunch, and I was just like, yo,
I went to a gala in Nashville
right.
like 3 months ago, supporting one of my good friends, Angelica Garrett, who's receiving an award in speaking, and I stayed at the Thompson for the first time. And I was
that's
like,
my favorite hotel. That's my favorite hotel.
Nashville has come up since I've been here.
It's crazy. I can't even recognize it. Like I either stay at the JW or the Thompson, and you know they're right next to each other. But I love the Thompson for some reason.
It was
like
a great
the boutiqueness of it.
Rooftop vibes.
Yeah, for sure.
Definitely
LA
fun.
Jacksons. There we go. So what's one of the craziest stories you've had with someone trying to get their medical marijuana card? Because I know you've had like some.
So many.
I know you've had some different type of people.
Yes, I see them all, and I welcome them all. And the thing for me is, I may not be the doctor for you. You may not be the doctor for. You may not be the patient for me. Like, it has to be a mutual symbiotic relationship, because we got to build an element of trust and transparency. So understanding your intention behind why you're using, what your plan is when you obtain the product, and making sure that you're going to do it in a safe manner, because it's not something like where you come into the ER where we see everyone, regardless of who you are. Like, I have the ability in my concierge practice to pick, choose, and refuse patients that don't align with my energy and spirit, and most importantly, safety, because I have parameters in how I prescribe and recommend, and I want to make sure that patients are doing it in an efficient manner.
Right.
So the most crazy thing that I've probably seen recently was, I get patients who are on parole and they want to, be able to smoke or be able to ingest cannabis, and being on parole, you're still technically not allowed, because it is federally illegal, despite the rescheduling of cannabis recently from Schedule 1 to Schedule 3, and all of that has happened. It's still federally illegal. So you would have a positive drug screening when you go to do your urine analysis test with your PO officer every month or every week, or how frequent you have to go for these check-ins. So they wanted their cannabis card, and they are like, want it now, immediately.
Right.
So I'm explaining to them the process, and I'm helping them understand, like, okay, this is what you have to do and stuff like that. But the good thing about Florida is it is electronic processing.
Okay.
You can get same-day approval if all of your paperwork is correct and you're authorized, and do your physical exam and everything with your physician on a timely manner. So there is the potential to get your card within 24 hours electronically and get same-day approval. But yeah, a lot of my patients on parole and trying to make sure that they are not breaking the law and they have a medical reason to use their cannabis. And I get it. You coming out of, 5-year bid, 10-year bid, like whatever it is.
Right.
Your family's stressing you for money. Like, you got a lot that you're dealing with coming out of that scenario. And I'm very sensitive to that, and understanding that we always want to build our men up and our women up and make sure that they have the medication they need to help them to be effective.
That's dope. So, switching back to my realm, back to plastic surgery. So, what do you think, of women getting plastic surgery in general from a cosmetic standpoint?
I love it. I love to
hear that.
I honestly, I think what has happened with plastics is we've seen a excess in society in everything. So an excess in access and availability, and also you can get a $5,000 BBL or you can get a $25,000 BBL. So you have to understand what you're paying for is what you're going to get. So understanding the value and emphasis of paying for something that is exactly what you want, with a board-certified physician who is going to have post-operative management and hands-on care with you. Like, those are really critical. You can't just go and do a 6-hour procedure and walk out and never talk to your doctor again.
Exactly.
You want to make sure that you have built those relationships and they have an amazing, staff and team to help manage you afterwards, and they make sure that you heal well. So I love, personally, plastic surgery. I recommend it for anyone who is psychologically ready for it.
Yes, that's a big thing.
I think emotionally, it's painful.
Yeah.
You know, like, there's no way to say it. Whatever you're doing, anything you cut, snip, tuck, pull, it's painful, regardless of how strong and how high of a tolerance you have.
Right.
So you have to be psychologically ready to endure that. And typically, women and men, once they get to the point that they are ready to go under the knife, they want it. So they are ready for that. But doing your research is the key to having a successful procedure, anything that you choose. And there's such a variety. And I think one thing that's misunderstood about your specialty is a lot of people think plastic surgeons are specialists in every aspect of the body,
Right.
not realizing that there's plastic surgery specifically for breast reconstruction,
Yep.
plastic surgery specifically for rhinoplasties,
Yep.
plastic surgery specifically for BBLs, and they specialize typically in a certain area of the body where they have the most documented cases and procedures and successes. So if you've done 500 BBLs, I want to go to you and not your partner who's done 20.
Exactly.
Even though you're certified to do BBLs because
Yeah.
you've done 20, that's not your specialty and that's not your day-to-day procedure. So
Exactly.
helping people to understand, like, you're a specialist of a particular area because that's your extensive training and your customization. Like, patients think plastics does everything plastics, whereas facial plastics, hand plastics,
Yep.
torso plastics, like they all have different physicians within the realm of plastic surgery. So finding one that meets your needs, that has documented cases that have been successful, is important to interview and understand when you talk to your physician, because they'll be like, yeah, I do it all. But no, I don't want somebody that does it all. I want to know, like, how many hand surgeries have you done if I'm going to undergo hand surgery?
Like, I can do hand surgery, but I don't do hand surgery.
I don't do hand surgery.
Exactly.
And I don't profess to do hand surgery.
I'm telling you. Like,
we
if
have
I was forced to,
limitations.
like, I'll make it
could.
happen. But, to make it more, it's all in the details. It's all in the details. Like, for myself, I feel like that I specialize in cosmetic breast surgery and cosmetic, truncal aesthetics. I feel like body contouring. That's where I'm.
Yes,
at.
and that's
So
an art.
That's what I like. So.
And that's art, and that's what you post.
Yeah, exactly.
You don't sit here and post hand surgeries
Or
and ankle surgeries,
facelifts,
and
rhinoplasties.
and mini facelifts and threads, and you don't post all those things when that's not what you do on a consistent daily basis.
Exactly.
So you're not misleading, whereas other physicians have the propensity to be misleading because you're going by social media likes. So if you see 600,000 views on this video, this must be his best procedure. Not necessarily. It was just a good video, a good reel.
Yeah. We had that one good result.
Go beyond the depth of social media. Ask patients who've had work done with that physician, like, how do you like them? How was their bedside mannerism? How did you enjoy your procedure and your postoperative care, stuff like that.
Yeah.
And I think Dr. Triggs emphasized earlier the importance of recovery, because he can do all that work for 6 hours, and if you don't take care of it,
Exactly.
it all went
to
to hell for no reason.
Definitely. So, you mentioned your daughter earlier. So how do you balance, like, motherhood and your work? Because I know you do speaking engagements, you're in the ER working, you got your concierge practice, you got your motherhood, you got the fam, your mom and hanging out with your sister and stuff like that. So how are you balancing all of this?
The beauty about what I do, well, I'll tell you where I'm at now. So today, I've recently stopped prescribing for patients within the last 2 months. And I've transitioned into a medical director role.
Okay.
So I am now the medical director of a company by the name of Eden, Florida. They are a newly licensed cannabis company that will be launching in the fall. The first location for our dispensary will be in Orlando. So it's taken me 7 years in growing my practice, that I've now transitioned to other physicians to be able to run the day-to-day, and being a medical director of a cannabis license and being a practitioner are a conflict of interest. So I can't prescribe cannabis and also grow it.
Right.
So now I'm stepping into the actionary side, where I'm able to learn about cultivation and manufacturing, production, clean production and dispensing of cannabis, and help to influence laws and regulations about THC limits and boundaries and home grow, and on the political forefront of cannabis and its effect in Florida. This is an election year. So we got a lot that we're trying to do in helping to get cannabis approved for recreation on the ballot. And there's a lot of parameters around that as well. So I've stepped a little bit away from the day-to-day engagement with patients and going on the side of being a administrator in the cannabis field. It's a brand new field, and I'm learning a lot with grant writing and proposals and stuff like that. But it's been pretty awesome. It's a great opportunity. There are 25 medical directors in the state. I'm one of a handful of women and one of less than 3 Black.
Oh, wow.
So it's important
Congrats. That is so dope. That's super dope.
Important to take your role seriously and always elevate in the space.
Right.
So when I started my office, Ask Dr. Lyn, I didn't know that this is what I wanted to do, but as I grew and learned more where I can be impactful, it's important that I chose roles that I can help see legacy and longevity. So this was my next step in the business, still practicing in the emergency room on a part-time basis. So I've taken a little step back from that so I don't have to be there as often, but still doing at least 6 shifts a month to keep my skills up and to be consistent and also to be able to teach and work with residents. And then at this stage now, my daughter's 14, my niece is 17, like they've required a different level of engagement. My niece is college tripping. She's getting ready to, go off to college. She's entering her junior year, whereas my daughter is graduating from 8th grade next week and going into high school. So what they needed from me when they're younger is very different from what they need from me now. And they say they need you less as they get older, but they don't. They need you differently as they get older. So to be present, to be a friend, to be available. And one of the things that has been really important to me is to be home a little bit more. So in managing family and making sure that really I'm maneuvering a lot with her schedule between gymnastics and track and school and stuff like that. I've just hired ancillary help as well too. So having a driver, having a chef, having a housekeeper, like all of those things has helped to allow me more free time to be present for her.
Enjoy the fruits of your labor.
Enjoying the fruits of my labor, and then also fostering love and fostering personal side, because if you don't have
so you got
balance,
a chef? I just caught that. I'm ordering these meal preps. I need to get me a chef, but I'm never home enough. But that's dope. That's super dope.
Yeah, I think the thing with me that was important, like I grew up eating at home nightly. Like my mom cooked every day. We come from backgrounds that our parents, there was always something in there. You look in the fridge and like, there's nothing in here. What are we going to eat? Oh no, they whipped up a meal in like 30 minutes.
We got McDonald's at home.
Exactly. So it was important for me to make sure that, I helped teach her the importance of home cooked, and she's loves the process, loves the Starbucks, loves this. And I'm trying to just help her understand as an athlete, like, you can't have a Egg McMuffin every day. You can't have this every day. So understanding the importance of quality, meat and quality seafood and things like that. So I want to show her that with fresh farm to table.
Right.
So I've been working on that a lot and getting my skills up.
Right. So what are you doing for you? Like, how does what is self-care for you? What do you do in your free time?
Oh no, working out is essential. I lift weights a lot. I'm getting more into Pilates and running, but I would lift weights on a consistent basis. That's been my routine. But people think, oh my gosh, you're just vain, you want to work out. No, it's actually a mental stress reliever for me.
Right.
And if I don't do it, I see the difference in my attitude and my spirit.
Yeah.
So same like you, like working out is essential to balance and to maintenance, and it's my time for myself.
Right.
So it's at least 4, sometimes 5 days a week on a good week, but I try to do it Monday to Friday, take the weekends off, and it's that solitude right after dropping her off in the morning where I get that hour to myself that I get to engage and really invest. But working out to me is key for self. And then I also do all the other stuff. I like to scroll on the gram. I like to online shop, all of that.
Oh, we know you. Well, I know you like to shop. I think you get the Travis Scott's on, you blinged out. No,
I'm trying to catch up with you. You're the one with the collection.
Stop, big dog. Stop, big dog. Big money.
Have you guys seen his sneaker collection? His sneaker collection is stupid. And the kids. They got their own little collection. You don't buy one, they buy 3 at a time.
Yeah, and it's hard too, because I'm like, I had to hit up G-Den or one of my homeboys and be like, yo, I need you to get these size 1s for me for the twins. So we make it happen. So what's something that that people don't commonly know about you? Because you are semi-private. Like, even though you
Super
post,
private, yeah.
you don't put a lot
I
out
let
there.
you know what I want you to know.
Exactly.
Definitely.
Like me.
Unless we're on the phone and
Exactly.
we're rapping every day. Like,
Right.
yes, I am. That's one thing that I maintain is a level of privacy and intimacy with
Right.
my family. And I've been understanding the power of not needing to be on social all the time
Right.
in order to still stay engaged, you know? So when you do post something after a couple weeks or after a couple, days, they're like, "Oh, she's back!"
Yeah.
Like, "What's she doing? What's going on?"
Yeah.
So it's more enticing. Before, I think when I first started, I was one of those people like, I always have to have a story popping. Always have to have this. What am I eating today? Oh, we're drinking champagne.
Yay, turn up.
It became a obsession. And then I finally started to pull back. The more I spend time reading, just personal enjoyment reading. Like right now, I just picked up Deion Sanders' new book. That's my next one I'm about to get into. And it's been a journey. I just finished Jada Pinkett Smith's book. But the reading thing has been really cool for me because I'll do that in my downtime. The working out thing has been personal. But one thing that people don't know about me is I have and probably a lot of people in our position have a very controlling personality.
Yeah, the type A-ness.
I know, and I'm trying to release a little of that power.
Right.
Because I know
It
you
can
can
control
do it.
you.
It can control you.
Yeah.
It can control you, and it has a tendency to make others feel incompetent or not needed. So I'm being more intentional about being a little less controlling in my life.
I love these words, intentional, things like that. Sounds like some
Yeah.
therapy has been done.
Guys don't like that when you're like, I got it. I'll change a tire. I'll pay for it. Like, they don't like that. They feel belittled. So I'm trying to release a little bit and just kind of sit back and let it do what it do. So I'm learning that that I don't have to be that independent, sassy woman all the time, and I can turn off a little bit and be a little softer and be a little bit more patient in life. But that has been a hard thing for me to release because at work I am the director. I am the boss. When that person dies, it's not the nurse's fault, it's my fault. You know? Like, it always falls on me. So I'm always in a position of decision making. So I've come to a point now that I'm like, all right, I gotta chill a little bit.
I understand.
Yeah.
Well, that's a perfect way to wrap things up. So if people want to follow you or know more about you, or particularly, I know you're not really practicing as much in certain spaces, how can they know a little bit more about you or follow you or anything like that?
So social media at AskDrLyn.com, and that's universal for YouTube, Facebook, Instagram. I'm actually presenting at the Florida Medical Cannabis Conference in Orlando this Saturday. It is a 2-day conference, one of the largest conferences in Florida, specifically for medical directors and physicians to help maintain their skills and network and interact with other physicians and learn more about their practices. If you want to know how to start a business, how to start a cannabis business, what does it mean? Definitely a conference to want to attend, whether that's in person or virtual. Just hit up fmcc.org. So I've been working on that, and that is this weekend. And typically in the summer, I take a month off. So I'm getting ready starting June 5th to take a month off and decompress and detach and chill. I'm taking my girls to Dubai and Maldives, and we're going to veg out and kick it for a little bit. So I'll be back online starting in July, but I'll tease you with some stories.
That's what we need. Like, I'm definitely going to be tuning in because I'm going to be at work. I'm going to be working. Why you chilling? I love it, though.
Yeah.
No, well, thank you so much. I really appreciate it. Like, this is one of my first friends in Miami. We have a mutual friend, Dr. Ashby, who's also been on the podcast.
What's up, Ash?
So, shout out to Bernard. But, you are good people. I'm so proud of everything you got going on.
I'm so proud of you. Literally, you came down and you told me your plan, and you hit the ground running, and you haven't let up off the gas since you've been here.
Foot on next.
To see where you are today, got your own podcast space, your own office, so proud of you.
I
so proud of you.
appreciate it. Thank you so
Love
much.
it.
So, two Meharry alumni trying to make some things happen down here in South Florida. I love it.
HBCU love.
Exactly. So, guys, thank you so much for tuning in for Triggs Table Talks. Like, click, subscribe. We're going to have dope people on here just, telling their journey, giving you great information that can apply to you. So, drop comments in the links below, reach out to these people. And until next time, thank you so much to Triggs Table Talks.
Woo! Good job.